Hello, I'm Dr. Sunil Kutty. I'm a brain and spine surgeon working at Apollo Hospitals, Navi Mumbai. Today I'm here to talk to you about a very interesting facet of patient care. Almost 80% of us as humans at some point in our lives are expected to have back pain. Thankfully, most of it go away on its own, but few of them do require our assistance. The assistance would be in the form of a simple consult. It could be in the form of some medications. It could also be in the form of an advice for undergoing physiotherapy. But yes, there is a subset of patients in whom we advise surgery. And unfortunately, the moment the name surgery crops up in a patient with a spinal issue, people directly go on the back foot. And I cannot say it's their fault. It's because they've been misinformed all along. It's because they've gone and asked their neighbor or their uncle or their aunt and somebody who they know have undergone a spine surgery and must not have had a very pleasant experience. And based on that, they tend to extrapolate it to their own problem. But the good thing is, spine surgery is not problematic. It is pretty much safe. And with the kind of techniques that have evolved now, we normally discharge these patients in a day or so. So that is what we are looking at. Now, to understand this, we have to look at two things. Why this misinformation? This misinformation is primarily because of the way spine surgery has evolved. So it has evolved from a place where we used to do open surgical procedures, where large incisions used to be made, a lot of muscle dissection used to be made, and bigger the incision, so the problems which were expected was maybe slightly more than usual. So that is where we started from. Now we've evolved to a stage where we do most of the surgeries under a microscope. The incisions are smaller, there are minimal invasive approaches. So things have undergone a dramatic shift as far as the patient care goes. Apart from that, the other problem that comes up is the problem of expectation that people have. So once anybody decides to undergo a surgical procedure, they think that every problem of that would be taken care of with that one particular surgery. Unfortunately, that's not the case. If you understand, most of the spinal problems are found in the older age group. So apart from the spine, there could be a problem in the hip, there could be a problem in the knees, and all these things come together and make it difficult for them to walk. So the spinal surgery is done, but that does not mean the rest of the problems are taken care of. Not that all these require surgery, but yes, those problems are bound to linger, and that wee bit of dissatisfaction stays because the other problems are there, and then you start associating it with the back issue. So that is another problem. That problem creeps up because of expectations. And to solve that, it's very important that you talk to your doctor prior to the surgery about what to expect after the surgery is over. After, in your phase of recuperation, what do you expect in terms of recovery? So that's one thing which you should ideally make it very clear. Now let us understand how spine surgery has become safe for us. So when we look at spine surgery and the safety associated with spine surgery, it is important to realize why are we operating in the first place. Most of the surgeries in spine are done for 2 to 3 very common reasons. One would be pain because of compression of the nerve. The second would be weakness in the limbs or paralysis or paresis. So that would be the second reason. And the third reason would be instability. So largely one involves compression of the nerves and the nerve roots, and the other involves the bony structure. So the idea behind the surgical procedure is largely to decompress the nerves, decompress the spinal cord, that's one. And second would be to stabilize the spine. So these are the two things that we are aiming the procedure at. Now, when it comes to these procedures, then we come to diagnosing these problems. Okay, which is the specific nerve that is getting compressed? Which level is the one which is involved in this compression? And the MRI and the CT scans which have come up now. We have 3 Tesla MRIs, we have now up to 7 Tesla MRIs which have come into the market. So these MRIs make it extremely easy for us to recognize the exact point at which a nerve is getting pinched or compressed. So in terms of investigations, the kind of progress that we've made makes it easy for us to actually localize the site of lesion. So that solves one problem, ideal or correct localization of your problem. Now we come to other tests also like EMG and CV. Again, these help us further corroborate our clinical acumen. So we we end up diagnosing your problem that much better. So once we are very clear about the problem that you're confronted with, we can go ahead with the treatment. Now, when it comes to the treatment, the safety again has improved because most of the surgeries are now done with a microscope. So what a microscope does is it puts light at the region where we are operating, and the whole site is magnified also. So when we see something which is very tiny in a very magnified form with ample light over there, obviously the surgeon is trained well enough to not make any errors while operating. So he would go ahead and just decompress that nerve which is getting compressed without damaging the nerve. So that is how damage to the nerves, damage to the neural tissue are avoided because of these facilities which are available. Apart from that, even when we are operating on cases where there is significant spinal cord compression or there is a tumor sitting inside a spinal cord which is compressing the tracts which are passing through it, we have now we have access to something called as intraoperative monitoring of these the nerves. So we can actually monitor the fibers which are passing from the tumor or next to the tumor, and these are again attached to a machine and a computer which will tell us whether it is getting damaged during the course of the surgery. So intraoperative monitoring helps us on that front. So the possibility of damage further goes down. Now, apart from that, the most important would be the anesthesia techniques have evolved so beautifully that the surgical procedure is not just pain-free, it is extremely safe also. So when we look at this whole bundle, where we have good pre-op diagnosis, where we have good intra-op procedure being done with all the safety measures being taken, all the protective measures being taken in terms of keeping the nerves safe, in terms of decompressing the nerves well. And so when we have all these things in place, the safety obviously goes up. The other facet where we have the surgery come into fore for spinal problem would be spinal instability. In such cases, we have to put implants over there and stabilize the spines. So it involves putting in screws and plates and rods over there. Over here, the important thing is to put it in the right direction. So without, again, damaging the nerves or the nerve roots. So this can again be done with good C-arms. These are intraoperative monitoring devices. So we have a C-arm, we can have O-arms. Apart from that, we have neuronavigation also, which tells us exactly in which direction the screws are headed. We have robotic spine surgery. Again, it has a similar use as a neuronavigation system, but the robo does the same job. So we have systems in place where we can safely put in screws also now. So now when we look at the whole thing, so we are safe in terms of the nerve damage, we are safe in terms of the screws and your stability being maintained, you're safe in terms of anesthesia. And these are the few developments which have happened in the last 2 decades or so, and it is being constantly amended, and we are getting better and better and better day by day. So that's the most beautiful aspect of it. So next time you have this question crop up about whether spine surgery is safe, you have to think about all these points. Okay, have I been completely investigated? Does the place have all these things that he was talking about? Do they take all these safety measures? So these are the important things which will make your spine surgery safe. And instead of relying on your uncle or auntie or your neighbor's brother who's undergone a spine surgery, it is always better that you go and ask your doctor, because every spinal problem is a different problem. Every spinal problem, the end result that I would expect from the patient would be different from what I would expect in another patient. So that's it. Spine surgery, I would say, is definitely not unsafe. It is pretty much safe. The only thing that we have to understand is where it is needed, and if it is needed, I assure you it is supposed to give you benefits in terms of recovery, in terms of returning back to your normal life. So don't delay your surgeries because of this fear. Thank you so much.